Getting up multiple times at night to pass urine is not uncommon in elderly population, which means up to 1 to 2 times getting up at night could be a common situation at any age group. We normally get up once because we drink a lot of liquids in the evening, maybe twice too. But getting up more than twice could be related to a situation where your sleep is disturbed, your entire night's regeneration and remodeling capacity for your body has gone wrong because you're not able to manage yourself in terms of being able to have a deep sleep or the REM sleep that's required. So, of the stages of sleep, the sleep that is required for you to regenerate and come back to normal, fresh in the morning, is that deep sleep. And in that deep sleep, you have dreams, you have got everything around. Those are missing in people who get up multiple times at night. And that's called nocturia or getting up multiple times. That's more common in elderly people. So if you look at 60s, 70s, and 80s, people have on one side very light sleep. The sleep is gradually very light, and something very trivial can wake them up. On the other side is the increased production of urine at night by the kidneys. So kidneys are producing more urine. And the more amount of time the bladder is getting filled up, and you're woken up. Why you are not woken up, you're almost awake. That means a very light or a mild sleep at night, and a lot of urine production at night. That is what defines geriatric population or elderly people. Our fathers, our mothers, our grandparents all live with that agony of almost being awake and tossing in the bed, waiting for mornings to happen. Well, unfortunately, the kidney is producing more and more urine. That's called nocturia, nocturnal polyuria, more production of urine at night. So more production of urine at night can happen because of multiple reasons. The common reasons we look at is age-related circadian rhythm changes happening, which is going to bring about polyuria at night, and that's called nocturnal polyuria, excessive production of urine at night, just even if you don't drink too much of water. As a society, we are known to be living in times where we have got water, tea, coffee, milk, alcohol, a lot of things in the evenings and late in the nights. And all of them will only produce more urine. In fact, tea, coffee, and alcohol actually serve as diuretics. They hammer the kidneys and make you produce more urine around. That means you're actually pushing the kidneys to produce more urine, and it's going to come down to the bladder. At times, you don't want the bladder to be too full. So, frankly speaking, elderly people with lighter sleep, tossing in the bed, almost awake at night, getting their bladder filled up more frequently, is one common phenomena called nocturia. I get to see a lot of them. Unfortunately, we relate it too much to the prostate issues, and they may not always be interlinked. Though at the same time, parallel as age is changing and things are maturing, the hormone is making about changes in the prostate, and prostate is enlarging and growing. So a combination of these things bring about an elderly person in late 60s, 70s, why even 50s too. And they come complaining about getting up multiple times at night, called nocturia. At the same time, they're busy drinking tea, coffee, water, milk, alcohol, everything late in the evenings and nights. Same time, the prostate is undergoing an enlargement, and the bladder has to compensate to this obstruction to the flow of urine. And in doing so, the bladder has to contract more, both by day and by night. More so in the night, it has to actually compensate for the amount of fluid which comes in, which has to be emptied. And therefore, the bladder learns another behavior which is gradually being thrust upon it. So multiple things happening together. Don't forget that many Indian men and women also have diabetes. And diabetes is a state where you have got polydipsia, a lot of thirst, a lot of hunger, and a lot of urine production. So a lot of urine production at night almost defines an elderly gentleman or woman in the country who has got diabetes, and more so uncontrolled diabetes in our place. So let's wake up to the phenomena as to how to give them a content and contain their trouble. So the content here is nocturia or getting up multiple times at night can happen because of multiple reasons, which also is because of diabetes, because of cardiac issues, because of eating and drinking a lot of things at night, which are detrimental to health, detrimental to the amount of things required in the body at night. And therefore, it will be brought about as waste product, especially urine, and that would probably make you go again and again. So elderly people with light sleep, number one, diabetes uncontrolled or controlled, but diabetic elderly individuals, prostatism or prostate issues, all of them have got issues which finally would make you get up multiple times at night, which is called nocturia, getting up more than 1 to 2 times. When we're looking at nocturia, the first thing which we explain to people across the table is about behavioral therapy. That means you will have to change your therapy to bring about the bladder or body to behave in a very different manner to what is happening. I suggest people should be actually having their dinner 2 hours before they go to sleep. Cut down your beverages in the evening, which includes, as I discussed, all the liquids that you continue taking in. Across the table, I tell many people to become a Jain compared to whatever they are in terms of having their food and water and beverages and their dinner all getting over earlier in the evening rather than continue to drink late in the night. Obviously, summer season is catching up in 2023 and we are all thirsty. So we could drink good amount in the daytime. The body has got enough reserves. And therefore, the thirst of the tongue is something which can be quenched with a lesser amount of liquid, that more. Don't forget that you and I are lucky individuals because we are not cases of nephrology, cases of cardiology, where you have to be restricted on the water intake. So luck has it that we can drink good amount of water. Dividing good amount of water is required in patients who form stones. On one side, when I see stone formers across the table, which we operate all 6 days a week here, both in routine and in emergency, we make them drink good amount of water divided across the day before and after principal meals. On the other side, we have got individuals who are elderly in the society who have got issues and difficulty about getting up at night, about moving to the washroom at night, related to arthritis, related to age, related to weakness, related also to possibility of neurological changes, spine and Parkinsonisms. With all this, you really don't want to get up multiple times at night, have a fall and have an injury. So all elderly people who are having nocturnal polyuria or excessive production of urine at night can be treated a lot by behavioral therapy. In other words, cutting down their excessive amount of fluid at night, excessive amount of beverages at night. Please avoid your tea, coffee, alcohol, milk, etc. Everything after 7:30, 8 o'clock in the night. You should have 2 hours of gap between your dinner and sleep. And look at that, you're not busy drinking too much. That's one way of looking at what you can do for your body. Rest a urologist will always do for you. He will pinpoint nocturia and find out the causes of nocturia. On one side, there are urological causes, which includes prostate issues. Now, women don't have prostate issues, but they still can get nocturia. Diabetes as such an endocrine issue. Untreated or decompensated heart disease can bring you a lot of nocturia. And as I said, polydipsia or drinking too much of water at night. Estrogen deficiency is one aspect which actually brings about overall body changes and women produce a lot of urine at night. So umpteen reasons why urine will be producing at night. One of them is also you've got a lot of leg swelling and that actually gets absorbed into the body, into the circulation. And your amount of circulatory fluid has increased and therefore the kidneys will be requested to probably empty away the extra amount of fluid. So all those people who have vascular diseases, nephrological diseases, endocrine diseases, may just produce a lot of urine at night, a waste product which has to come out of the body to maintain a good homeostasis or a mechanism that is required. So let's wake up to this phenomenon of nocturia, more so suffered by elderlies. And that age group has got so many comorbid factors, so many diseases, and so many medications too. They have to continue taking medication with sips of water late in the evening. And about our entire story about getting up multiple times at night only wakes up as more and more people come and complain कि हमें रात को पेशाब बहुत ज्यादा बनता है, हमें बार-बार जाना पड़ता है, and there are medications available. Now remember, when we give medications for nocturia, we want to pinpoint the causes, and one of the important causes is nocturnal polyuria, for which there's a very specific medication available today. You don't want to be bedwetting at night. Unfortunately, some of the elderly people are in deep sleep and may do bedwetting at night, and that becomes almost a serious emergency on that night. So I think at the Kokilaben Hospital in the Department of Urology, we seek forward to look at this nocturia and bedwetting clinic, which is established, where people come with multiple times of urination at night, not able to control in the daytime. Children come with bedwetting at night in the age of 6 to 15 years. And we looked at this nocturia and bedwetting clinic as a very important niche area to improve the quality of life of individuals who suffer with urination more so at night where the world is sleeping. They're actually sleeping in urine where they're wetting at odd times and odd hours, and the caregivers can only manage this much. So nocturia are getting up multiple times at night for elderly people, for people who have got prostate issues, for people who have got diabetes which are uncontrolled, and people who have got other hosts of issues which can produce more urine at night, more so also by drinking. And for children who have got bedwetting at night, which happens at that very important formative years of milestones called 6 to 15 years, called as enuresis. We look forward to improving the quality of life of individuals at the Kokilaben Hospital by continued non-stop work on this subject by identifying and looking at right approach to the right individual. And therefore, choose to come to a Department of Urology at the Kokilaben Hospital, and to all my colleagues in urology and pediatrics across the city and country who are deeply immersed into the subjects of bedwetting and nocturia and improving your quality of life at night when you want to really sleep and want to go to sleep and regenerate well. So wish you good luck for all who have nocturia or getting up multiple times at night. It's an important issue. It's probably swept under the carpet. We don't discuss too much about it, but it's so much bothersome. Many times I must have woken up at 2 o'clock and 4 o'clock at night and could not get any more sleep. So I look at our parents and our grandparents that they get up at night and they don't get to sleep anymore. And they're tossing in the bed waiting for the day to break, and they probably would feel better. So I think it's time to wake up to this kind of quality of life issues, which we should not live into. For example, I've got an issue where women leak urine, people have got frequency of urine, men have got erectile dysfunction. These are all quality of life issues. And people continue to linger and suffer and probably continue to live with it. Recurrent urinary tract infection always has a cause, and people start giving antibiotics. I need to identify the causes and therefore probably pinpoint a treatment. Friends, right approach to the right individual, and therefore dial you for urology, and your urologist in your cities is doing awesome on this. It's all about awareness. It's all about complaining. If you complain, you probably get it in time, and rightfully so. I wish you good luck, and let's catch up again on this aspect. Thank you.